Hello, and welcome to your State Health Benefit Plan video guide. I'd like to take a few minutes and go over some very important features your health plan contains. If you need more information, it can be found in your State Health Benefit Plan Employee Decision Guide available from your employer. Remember, employee benefits play a large role in most families' overall financial planning, so it's important to understand them. The most important piece of your employee benefits is your health insurance. Your health insurance is provided by Blue Cross Blue Shield of Georgia. Express Scripts is your pharmacy provider, and Healthways is the wellness provider. Blue Cross Blue Shield has an extensive network of doctors and other healthcare providers. Referrals are not required to see a specialist. There are no pre-existing conditions, and disease management programs are available. You have 3 plans to choose from: Bronze, Silver, and Gold. They are all a part of the Blue Choice Open Access Point of Service Network, providing both in and out-of-network benefits. Each of the plans cover the same procedures, such as doctor visits, outpatient and inpatient hospital care, emergency coverage, and preventive care. Each of the plans also have the same copays for services. A copay is a flat fee you pay for covered in-network services, such as eligible primary care and specialist office visits, emergency room care, urgent care, and retail health clinics. After a copay, the plans cover 100% of eligible costs. Copays range from $25 to $150 and are the same for the 3 plans you have available: the Gold, Silver, and Bronze. Copays do count toward your annual out-of-pocket maximum. However, they do not count toward your deductible and cannot be paid from your available HRA credits. Copays can be reimbursed from a Healthcare Flexible Spending Account, or FSA, if you elected to participate in one. Coverage for prescriptions is also the same for each of the 3 plans, and there are no deductibles that have to be met, only a copay amount for each prescription filled. All 3 plans have a health reimbursement account, also known as an HRA. The HRA is funded by state health and is like free money for you to use for certain out-of-pocket expenses, such as your plan's deductible, co-insurance, or pharmacy expenses. There is a base HRA credit given for each plan. Depending on which plan you choose, the initial HRA contribution is different. We'll come back to the HRA credit in a moment, but first let's take a closer look at the differences between the 3 health plans. As mentioned earlier, copays and covered services are the same for all 3 plans. The difference in the 3 plans is found in the deductibles, co-insurance levels, and out-of-pocket limits. Co-insurance is a percentage of the total cost of care that you would have to pay after a deductible has been met. The Bronze plan has the highest deductible and out-of-pocket limit compared to the other plans, but with the lowest premium cost to you. Should you move beyond a copay and meet your deductible, the plan will pay 75% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. Don't forget that your deductible and pharmacy benefits can be reduced with the HRA contribution. The Silver plan has a lower deductible and out-of-pocket limit than the Bronze plan. However, you will note that the premium cost to participate in this plan is higher than the Bronze. After meeting your deductible, the plan will pay 80% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. This plan also has a higher contribution to your HRA account. And remember, copays are the same for all 3 plans. The Gold plan you guessed it, is the highest premium cost option. It offers the largest HRA contribution, the lowest deductible, and the lowest out-of-pocket limit. After meeting the deductible, the plan pays 85% of in-network covered medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. Don't forget that coverage for prescriptions is also the same for each of the plans. There are no deductibles that have to be met for prescriptions, just copays. While HRA credits can be used for pharmacy copays, pharmacy expenses do not apply to the deductible or annual out-of-pocket limits. A mail order benefit is also available. So how do you earn more HRA credits? By participating in the Healthways Wellness Incentives, you have an opportunity to earn even more HRA credits for your plan. The wellness incentives can, in total, add another $480 to your plan's initial HRA credit. And if you have a spouse who is enrolled and participates, another $480. Here's how this works. Step 1. Assess your health. Complete a confidential online well-being assessment. That'll take about 20 minutes. And step 2, know your numbers. Complete a biometric screening at your participating doctor's office or at a state health-sponsored screening event. Complete both of these and earn $240 HRA dollars. Step 3, you can accumulate up to another $240 HRA dollars in $40 increments when you take action. You choose between 2 coaching sessions completed over the phone, or track certain well-being activities online, or a combination of the two. More information on this can be found at BeWellSHBP.com. So again, that is up to an additional $480 for you and any covered spouse if you both complete these incentives. You will not lose any unused HRA dollars. Any unused HRA credits from current or prior years will roll over into your HRA account for next year. For those who enroll in the health plan, Blue Cross Blue Shield will mail ID cards. There will be an ID card for every covered family member, and the card will serve as the medical, pharmacy, and wellness ID. The State Health Benefit Plan offers health care coverage that is affordable based on employee wages and meets the minimum benefit requirements as they relate to the Affordable Care Act. So government assistance on the federal exchange will not be available to you. You can choose to decline to enroll in one of the state health plans and choose a plan on the federal exchange. But consider that if you do, you will be responsible for the total cost of the coverage you buy, and the cost for the coverage cannot be deducted from your paycheck. More information on these plans can be found in your State Health Employee Decision Guide available through your employer. Look for new, updated plans and options to come later this year. Remember, our job is to help you get the most efficient use of your benefit dollars. We appreciate all you do. Take care.